Hey guys, it's Dr. Provost, Phoenix Men's Health Center. We're talking about erectile dysfunction. We're talking about erectile dysfunction because nobody else is talking about it, right? So this is something that a lot of people don't want to talk about either because they find it embarrassing or they find it taboo. But the truth is that it affects millions of guys' lives, and it affects their lives in a negative way. It definitely affects their self-esteem, it affects their confidence, and it affects their overall happiness as well as their sexual relationships. We've seen this many times in the practice where erectile dysfunction affects the person's physical and personal relationship with the other half. So it's a very real thing. So if you're experiencing this, one, you're not alone, and also it is very real. So now we're about solutions, right? How do we find out the solutions to this? What I'm going to do now is briefly go over some of the solutions that are available out there at your primary care office, and then I'm going to make additional videos to expand on each one of those. Now, something I know that you're familiar with are the drugs like the Viagras, Tadalafils, Levitra, Stendra. These are all prescription medications. And what these do essentially is they help to make your penis more responsive to sexual stimuli. These medications don't necessarily work how most people think. They think if they take the pill, all of a sudden they're going to have an erection and it's not going to go away. That's not really how they work. These pills, once they're in your system, you're going to need some kind of a sexual stimuli to help encourage that blood flow. Basically what they do is they're going to make your erections work better. So your erections are still going to work the same as they would before with sexual stimuli. After you've had an ejaculation and an orgasm, your erection will return back to normal. So that's kind of the prescription pills. Now, something that's more advanced is something called Trimix, and what Trimix is essentially it's an injection. Now, it's a small injection with these insulin-type syringes, and these injections go into the base of the penis. And the good thing about these types of medications is that they work very well, but you got to be careful because sometimes they can work too well. We'll expand a little bit more on that in a second. And then the other thing we have here is called P-shot, Priapus shot. And what the Priapus shot essentially is, it's a shot that goes into the penis, and what it does, it helps to regenerate tissue. So the P-shot is kind of this advanced, you could say, erectile dysfunction treatment, and actually works really well. And of course, they also have penis pumps. So a penis pump is whenever the pump actually goes over the penis, creates a vacuum, and once that vacuum has been created, it sucks blood into the penis and encourages an erection. And then there's other things you can do to maintain the blood in the penis to help hold on to that erection. So of course we will expand on that as well. You also have the over-the-counter supplements that you can buy at your health food stores. They're supposed to work kind of like the prescription medications. And then you can also buy stuff at at gas stations or quick stops or pornography type stores. I don't recommend those at all because you really don't know what's in those, and you really don't. So I always caution against those. And then of course there's hormone therapy, right? Testosterone therapy. So testosterone therapy, thyroid, hormone balancing can play an important role in your overall cardiovascular system. So again, erectile dysfunction is a systemic problem. We often think, oh, it's just my penis that's not working, but it's an indication of what's going on in your whole body. So that's why it's important to get in touch with your doctor, talk about these, and find out what the cause is, okay? So whenever we find that cause, then we can figure out which one of these treatments is going to work best for it. So that's going to be our next videos. Check out the different causes, and we're going to break these up into a little more information for you, all right?